2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 15.
All right, thank you.
That level is wicked low out there. I don't know what's up with it. Oh. Bad one. So, this one.
Steve, I'm sorry, one more time, please. 1, 2, 3, 4, 5, 6.
Come in, everyone. Is that chair supposed to be there? Morning, everyone. How are you guys? How are you? Good, good. Dr. Thibodeau, how are you? Good morning, everyone. My name is Dr. Nirav Shah, and I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joined today by Commissioner Jean Wambrew, Commissioner of the Department of Health and Human Services. I'd like to start by providing an update on the number of cases of COVID-19 statewide. As of right now, Maine CDC has recorded 142 cases of COVID-19 across the state. It reflects an increase of 24 cases since yesterday's update. I'd also like to provide an update on some information that we've just received and wanted to make sure that everyone was aware about. COVID-19 is affecting all of us, and state government is not different in that respect. This morning, Commissioner Wambrew and I received a report of a case of COVID-19 in an individual affiliated with the DHHS office in Lewiston. About 12 minutes ago, we confirmed that this report is in fact a case of COVID-19. Maine CDC's investigation is underway. Our top priority in these situations is always to ensure the health and safety of the public as well as our employees within any unit of state government. So for that reason, Commissioner Wambrew made the decision out of an abundance of caution to close the Maine DHHS office while the investigation is proceeding. We want to be transparent with everybody about this information. As I noted, we've just received it, just confirmed it in the past 12 or 13 minutes, and we want to be upfront with everybody. The advice, the public health recommendations that we've talked about for several weeks now apply in any setting. That is to say, try to maintain that physical distance that many of us in this room are undertaking. If you're not feeling well, stay home from work and try to speak to a healthcare provider if your symptoms are consistent with those of COVID-19, namely shortness of breath, fever, cough, etc. Again, our investigation is underway. We will have additional information for you as that unfolds. And as always, our top priority remains the health and safety of the public and the employees, as well as this individual for whom we are trying to work with and ensure a healthy recovery. I'd also like to provide some updates with respect to our protective equipment. As we've discussed at these meetings, protective equipment is used by healthcare providers and first responders who are on the front line to keep them safe from COVID-19 as they are interacting and providing necessary healing medical services to the public. Protective equipment is also a scarce resource in Maine and across the country. And so for that reason, we have to make decisions about how to distribute it in a fair and equitable manner. Yesterday afternoon, Maine received its second shipment from the Federal Strategic National Stockpile of various different supplies of protective equipment. We can provide the numbers for you. We discussed those numbers yesterday. We received what we were anticipating receiving, and we are now in the process of pushing out those supplies of protective equipment to healthcare providers across the state. Let me say, however, that what we have received is not yet fully what we need. And we continue to support any moves by the federal government to increase both the supply and the speed of distribution of protective equipment from the national stockpile. Governor Mills sent a letter to both Vice President Pence and Secretary Alex Azar last week underscoring the urgency for this need, and we believe that letter is just as valid and important today as it was a few days ago when she sent it. Another aspect of how we distribute PPE is asking facilities to report to us what they have on hand. In any type of public health response, the data that we have are important in helping us make decisions. The way I think about it is that it's difficult to know where you should be going unless you know where you are. And in situations like this, those timely data help us know where we are so we can make decisions on where to go. And so starting today, we are asking healthcare institutions across the state of Maine to report to us not just the number of ICU beds and ventilators they have, but also to report to us how many supplies of different types of PPE they have on hand. That includes everything from N95 masks to regular surgical masks, face shields, and surgical gowns. That will help us get visibility into the highest areas of need as we are making these decisions. To just go through some of the numbers, as of this morning, there were a total of 151 ICU beds in Maine, of which 83 are available. The total number of ventilators stands at 306, of which 248 are available. I'd like to make one additional note on ventilators. The US FDA amended its rules for ways in which ventilators can be used in healthcare settings. In short, what they did was expand the number of ventilators that can be used given the potential uptick in demand. As a result of that, we have changed the way that we ask hospitals to report into ventilators. So you may see an uptick in our numbers in the ensuing several days. That does not reflect an addition of new ventilators that we, for example, have requested from the federal government. It does, however, reflect the latest guidance from the FDA that we have asked hospitals to take into account as we're doing our calculations. I'd like to next provide an update with respect to testing. We did just about an hour and a half ago, not even that, about an hour ago, receive a shipment of some of the chemicals, the reagents that we have talked about. That's very good news for us. It will allow us to continue with testing at our laboratory for a number of days. That being said, testing does remain a concern. And for that reason, we are moving forward with two of the projects that we've discussed. The first is to work with an outside commercial laboratory to have them help us get some of the tests done in an expeditious manner. The second is that we are also moving forward with an administrative purchase or a purchase of an additional extraction platform. This is something that we've discussed as well. This is a platform that helps us take a swab that is received from a patient and transform it into a way that can be put into our machine to read the DNA fingerprint. So both of those projects are moving forward, and I will continue to have updates on those as we get closer to fruition. I'd finally just like to end on two notes. The first is to underscore the significant mental health challenges that many people face. And I again ask everyone to recognize that everyone grapples and contends with the stress that is brought on by fear and uncertainty in different ways. If you need help, please reach out. There are folks out there who are willing to talk to you, whether that's by calling 211 or the Maine Crisis Hotline, the number for which is 888-568-1112. Someone is there for you, and someone is willing to listen to you. As a state right now, as a country right now, we need a lot of things. We've talked about a lot of those things that we need. But probably above everything else right now, what we need is compassion and kindness. So I ask everyone to focus on those in addition to the other things that are going on. Over the past several days and weeks, the state of Maine has also received an outpouring of generosity from folks across the state, across the country, who wish to help us. And we cannot thank them enough for that gratitude. I'd like to just close today with a couple of things that everyone can keep in mind to do in ways that can help this broader effort. A few of those tangible actions are, among other things, the first is to consider donating blood. Doing so in a way that complies with the governor's orders is possible. Blood donation centers in Maine are able to introduce that physical distancing to allow everyone to stay safe. As the governor noted yesterday, consolidating shopping in such a manner to reduce congestion at retail outlets can help. Fewer trips, and perhaps asking your elderly neighbors, your older neighbors, if they need anything before you go, could be a way, again, to reduce the amount of physical closeness, even though we're still able to, in making sure we're still able to satisfy our household needs. I also have a special request for healthcare providers in Maine. We've talked about these meetings indeed yesterday, some of the discussion around ventilators. And one of the things I mentioned is that in addition to having ventilators, we also need individuals who can skillfully operate those ventilators. So what I'd like to ask today is for any healthcare provider who is watching, especially if you happen to be a pulmonologist, a critical care intensivist, or an anesthesiologist, I ask you to go to mainresponds.org and register to be a volunteer. We don't know what the future will hold with respect to COVID-19. But what I do know is that I would like our healthcare workforce to be as ready as possible. In one way, one tangible thing that healthcare providers across the state of Maine can do, whether you are currently in active practice or recently retired, if you are an anesthesiologist, a critical care physician, a pulmonologist, or someone skillful in operating vents, please go to mainresponds.org and register to volunteer if that effort is needed. With that, I'd like to turn things over to Commissioner Jean Lambert. Commissioner?
Thank you. And I am here today to talk more about how healthcare providers in the state of Maine can help. But first, I want to say, as Dr. Shaw noted, I closed the Maine Department of Health and Human Services Lewiston office this morning because of a case of COVID-19. In so doing, I followed the protocols developed for all state employees and communicated last week to ensure that those employees, their partners, the providers in the community, and mostly the people we serve are safe. We continue to work in the department and throughout state government to follow the CDC guidance, teleworking and dispatching from home when possible, social distancing, spreading out people within office spaces, ensuring that they had the right tools to keep themselves and the people they interact with safe. But I will say from the heart that my heart goes out to my workers and the workers throughout Maine, the families throughout Maine who have been affected, because this does hit home. We will be releasing a press release from the Department of Health and Human Services later on today with more details. Dr. Shaw gave you what we know at this moment, but I would like to turn my attention back to how people in Maine can help during this crisis. As detailed in a press release that went out earlier this morning from the department, Governor Janet Mills has taken 2 actions to promote Maine people's access to health care in this time of COVID-19. First, Governor Mills has signed an executive order allowing licensed physicians, physician assistants, and nurses greater flexibility to contribute to Maine's response during the civil state of emergency. Those who are licensed and in good standing in other states can now, among other things, 1, receive an emergency license to provide health care either in person or through telehealth in Maine. 2, see patients through telehealth without obtaining a Maine license if already serving those patients at an out-of-state location. And 3rd, reactivate their licenses immediately with no application fee if retired. There are other actions that they could take. We urge you to consult our press release, but this is a way to bolster our healthcare workforce for people in the state of Maine. Second, all physicians, physician assistants, and nurses licensed in Maine, and those authorized under this order, may provide services through all methods of telehealth, including video, audio, and other electronic technologies to treat Maine people for all their medical needs. The order expands beyond accepted technologies previously used to include FaceTime, WhatsApp, Skype, as long as they are private. And the order also, as implemented by Superintendent of Insurance Eric Chapa, requires insurance companies to provide coverage for clinically appropriate services delivered in these means with payment parity, meaning that they would pay the same amount for services provided through these alternative means as in person. Superintendent Chapa is on the phone and can answer questions about the orders that he and his department issued, his bureau issued in recent days. I'll note that MaineCare or Medicaid already pays the same rate for most covered services, whether delivered in person or through telehealth. It's important to note that while we are aligning private insurance payments as regulated by the Bureau of Insurance, MaineCare or Medicaid, with Medicare through new emergency rules released by the federal government, self-funded plans offered by many large companies are not necessarily within the state's jurisdiction. The governor and I urge all of our self-funded plans to follow suit. While this all sounds complicated, the short story is that Maine has aligned all of our different payment policies to ensure that Maine providers and out-of-state providers willing to do so can provide health care, behavioral health care, other services to people who are staying at home. They too can stay at home and provide these services, and our goal is to provide whatever resources they need to train them on how to use this technology, to help them get signed up through our different systems, to ensure that they know how to use the tools and the technology. We are working with the Maine Medical Association, other associations in the state of Maine, to ensure that all this information gets out to clinicians here and throughout the state. Additionally, along with the Northeast Telehealth Resource Center, Maine Department of Health and Human Services will host a statewide virtual state telehealth town hall meeting Thursday, March 26th, tomorrow, for our healthcare providers to explain these changes and announce all the resources available to them to help them use telehealth services. I will note that joining telehealth, providing healthcare through telehealth is not the only way that Maine providers can contribute. As Dr. Shaw mentioned, Maine Response is in need. We urge you to look at that website and sign up if applicable. We are also working to ensure that we provide the support for healthcare workers who are on the front lines of COVID-19. It's not easy to be a provider of healthcare in these difficult times. So we will be working with the Maine Association of Psychiatric Physicians, Child Psychiatrists, Maine Psychological Association, EMS Maine, American Red Cross, and others to try to set up a warm line to provide our healthcare workers with the same kind of mental health and coping techniques that our 211 and other systems will provide. We're hoping that will launch in early April, but this is a call to all mental health providers. If you are interested in volunteering, we'll need your help. We'll put information on how to do so on the Maine DHHS website. Last but not least, I will remind all of our clinicians, all of our health providers, that we are putting our information on the Maine CDC website for you. It changes frequently. We urge you to check often. It is the ultimate source, our true source of information for providers. So we urge you to stay connected yourself, because your ability to contribute and volunteer and help is as good as the information we provide you, and we're working daily to provide that information for you. So I'll just close with a quote from Governor Mills. As a result of these actions, I am hopeful that more Maine people will be able to get the counseling, prescriptions, and treatment from their trusted healthcare providers from the safety of their homes, whenever possible and without sacrificing other basic necessities. With that, I thank you very much, and we'll take your questions.
Steve.
Maybe this is I'm not sure who can answer this question. Perhaps you. Can you just clarify, is the
the Lewiston facility, and which facility actually closed? I'm unclear on.
I will clarify that we did close the main DHHS Lewiston office. I will clarify that it was an individual who was in contact with that office. We are trying to respect the privacy laws about saying exactly who that was and where it was. But again, more information on our policy around that Lewiston office is forthcoming.
Commissioner, how concerned are you? What about child care workers? Are they still able to do their job in this time? Child case workers?
We have provided emergency guidance for our child care workers, the families who use them, on both what they can do to keep themselves and children safe, as well as rule changes to make it possible to continue to safely provide child care. All that is available at mainedhhs.gov, and there's a coronavirus green link. You can find that guidance there. And Dr. Shaw, did you want to add?
Well,
Do you want to?
repeat the question so the
Oh.
viewers can.
Yes.
Yeah. Michael.
Yeah, as a share, I'm just curious how many members of the DHHS and the CDC workforce are working remotely? Is it possible, for example, for COVID-19 response work to be done remotely?
So I'll speak a bit as to Maine CDC and then turn it over to Commissioner Wambrew. Michael Shepard's question is, just within DHHS, within Maine CDC, what fraction of the workforce are already working remotely, specific to those who are working on the COVID-19 response? So right now within Maine CDC, we have close to 50 individuals who are working on the COVID-19 response. And many of them, though not all, are working somewhat staggered schedules. For example, one of our team members, his kids are home from school, and so he's able to spend a little bit of time at home with his kids, but then on the weekends, he's with the team in person. So it really does vary, really by different job type. A lot of what can be done in the nature of a response can be done remotely, data analysis, data entry, but the piece that is extremely vital to the response, two pieces that are extremely vital to the response that cannot be done remotely. First and foremost are our lab staff. You can't run a COVID-19 test from your kitchen. And the lab staff in particular have been working multi-hour days, 12 to 16-hour days, without a single day off for several weeks now. And not only is that just coming to the lab, but they are working with under very difficult conditions with a highly pathogenic virus. So it's highly technical, stressful work that they've been undertaking for several weeks now without a single day off. I want to pause for a moment and acknowledge the sacrifices that they've made. They've missed time with their family, and I thank them on a personal note. The other piece that can't be done from home are our gumshoe epidemiologists. As your paper has covered, a lot of the work that our disease detectives do is not something that can be done from home. And so I again commend our disease detectives for truly being out there on the front lines talking with folks to get a better handle.
Can you elaborate on why that can't be done from home?
Sure. So a lot of the work that's involved with being a disease detective is not just talking to folks about where they've been, but it's also looking at their physical surroundings, if applicable. Not always, but if applicable. To see, for example, within a home, how much physical distance is actually possible, which helps us gauge the household risk to other members. So a lot of it really is out in the field, talking with folks to look at their physical surroundings in addition to just chatting with them. I'll turn it over to Commissioner for other elaborations.
So there are 3 of the 9 components of the Department of Health and Human Services that are continuing. Maine CDC, and I add my thanks to Dr. Shaw's. The Riverview and the Dorothea Dick psychiatric hospitals are the other 2. They, again, like other hospitals in the state of Maine, are rolling up their sleeves and donning their PPE to continue to serve people with high quality care. Of the other components, as of yesterday, over 60% were either dispatching from home or teleworking. We expect that that could go over 80% as we begin to every single day get the technology, get the tools for people to telework.
Great. Kevin.
Dr. Shaw, can you put the 142 cases in context? I was just looking, so last Wednesday we had 42 cases. You go back another week, we had 0. How concerned should people be concerned about seeing this large jump from day to day?
Yep. So Kevin's question is to put these 142 cases in context. And how should we think about what has undoubtedly been a rapid rise in cases, both in Maine, across the country, across the globe? So a few observations, Kevin. The first is that you're right. A week and a half ago, there were 0 cases, and now we are up to 142. We are right now where the United States was about 23 days ago. And maybe 24, maybe 25, I'll get you the more exact number, just trying to dial the United States clock back. So that just gives you a sense of when we talk about exponential growth with diseases like this is an illustration of that. The rate of increases of cases that we've seen is largely consistent with the rate of increases in cases in the Northeast, save for New York. So in that sense, we are where other cases have experienced, or other states have experienced. But in a sense, I want to say 2 things, Kevin. The first is that we do anticipate and expect that this rate of increase will continue. Where we are in the curve right now, based on models and data that we've seen from Italy, Washington, and a paper that was published just yesterday by the CDC about cruise ships, we are in that part of the curve where we do anticipate seeing additional cases, both in number and in geographic location in the state. The last thing I'll say, Kevin, is that there are a lot of questions that are related to the one you asked about when are we going to hit the peak, right? That's kind of implicit in the question you noted. And it's something that the team and I think about a lot. And it's premised on this idea sometimes because of the way we graph these things, right? It's premised on this idea that there is a peak, and much like climbing a mountain, that we would know when we're at the peak, right? But in this case, with a novel type of virus, in fact, with any kind of respiratory virus, we don't always know when we've reached the peak. That's how it is with influenza, for example, when it's not until a couple of weeks after the peak has been reached that we've detected that we were there. So in my own mind, I don't think about it as much as if I were climbing a mountain where I would know I'm at the top and could see it across the expanse. It's a lot more like following a meandering path through the woods. And I don't know where that path is going to end. There might be some hills that go up, there might be some valleys that go down. But it's not until I've reached that destination that I'm able to look back and say, aha, that's when I was actually at the peak. That's not unique to coronavirus or COVID-19. That's really the case with any kind of outbreak, especially respiratory outbreaks. So, yep.
Are we still seeing signs that it's largely community transferred or natural?
So the question is, are we seeing signs that there is continued community transmission, or are we detecting signs of some other type of transmission? Right now, based on where our investigation is, we are seeing the strongest evidence of community transmission in Cumberland County. We remain on the lookout and fully anticipate detecting community transmission in other counties as well. Most likely that will happen in counties where there are already a higher number of cases, but not necessarily so. What we have also seen in Maine, and this is consistent with the findings in other states, is a high amount of transmission within households. The term we use for that is a node. It's a small, confined area where individuals within that area have a higher than likely chance of getting infected because of a family member or a spouse. And we have seen a high number of those already across the country. Maine is no different in that regard. It kind of goes back to Michael's question about, well, why do our disease detectives need to be out in the field? Well, one of the reasons is because when we detect a case in a household, we want to see the household, we want to know who else is in that household, so we can really impress upon other household members the need to take as much care as possible.
Dr. Shaw?
Yep, Steve.
Can you, I don't know if you completed this analysis or not, but can you give us a breakdown of the cases that you have? How many of those where there was out-of-state travel or out-of-country travel, if you have that data, and how many community transmission?
Good. So Steve's question is, what more can we say about the 142 cases that we have, epidemiologically, demographically, otherwise? Right now, Steve, now that we've sort of reached the point where we have a sufficient number of cases where analysis would generate some useful results, one of our epidemiologists is actually working on that this week. Earlier, the numbers were small. And as with any small set of things, conclusions you generate may not be reliable. So we're working on answering and thinking about some of those exact questions right now. In addition to community versus non-community transmission, we're also looking at more general demographics like age, location, living condition, things of that nature, to try to get a sense of how the experience in Maine lines up with experience that's been published in other areas. Another thing that we're on the lookout for are individuals who may have transmitted more cases than others. Folks who may have visited different places and may potentially explain pop-ups of cases in other areas. So we're looking at all of those signs and signals that we call them to try to put forth a better picture. As you can imagine, that analysis requires a fair amount of epidemiological work and running a lot of models, but it's underway right now. Once we've got more findings, we're going to be putting that out as quickly as we can, making sure it's scientifically verified, and we're going to make sure we get that out there.
Quick follow-up.
Yep.
Hospitalizations, where are we at today versus yesterday?
Yep, Steve's question around hospitalizations, I will have an update for you either via Robert or via our website soon. Yep.
And kind of towards that point, can you talk, now that we're starting to get more of a sample size, on the percentages compared to other states and countries on hospitalization rate, and then we also have 0 deaths so far, and then also kind of how that plays into our ICU bed, and all of that.
So the question is similar to Steve's. How do the cases that we have so far stack up or compare against cases that have been experienced in other states, other countries, on parameters like hospitalization? As of yesterday's data, our hospitalization rate was largely consistent with cases that have been seen in other cases that have been published in the literature, which is to say a hospitalization rate of on the order of 10 to 15%. That's been the national experience and the experience of many countries in Western Europe. Now, the question there is, are there ways in which we differ from those experiences? And whether we can detect any signals from that would be concerning. Sort of consistent with Steve's question, that's something that we're looking at. The reason that I paused to note that is that we all recognize that the population in Maine, by median age, is the oldest, if not one of the oldest in the country. So we are paying close attention to that and trying to determine how that matches up with any potential resource needs. So that's a high priority right now for us. We'll have further updates and further discussion around that very soon. Yep. Michael, go back to you then.
What do we know about any rate at which Mainers are adopting social distancing? I've seen some national sources look at cell phone data, travel data. The Turnpike Authority has said travel's down by about half. What are the so what do you know about it? And also, what are the guideposts that you'll be using to sort of evaluate that in the coming weeks, perhaps as a basis for further action down the line, like what the governor did yesterday?
Great. So Michael's question is, what do we know right now about the ways in which Maine people have adopted, embraced, heeded the calls for social distancing? And much of what we know, some of it is of course anecdotal. We can all see this in our lives. I'm probably not the only person who has taken a look out of my window or when I've had to, driven down the main street in my town and seen that it's largely shuttered at this point. And I've certainly received reports of that nature from other friends. We also, of course, look at the data as they are coming in to see how those inflection points in our uptick might compare to other areas. Right now, based on where we are in our uptick of cases, it's still too early to know. I do want to underscore the need for everybody to really heed that physical distancing. It is right now one of the surest ways to introduce enough space between people so as to disrupt the natural transmission of the virus. I will also note that there were some early data that have just come out of New Rochelle, New York, in Westchester County, which experienced a very rapid rise in cases. And based on the very early data that I was sent, it does seem there that the very intense physical distancing that was introduced does seem to have resulted in a plateau. So we're, of course, looking into that, and we're hopeful that we see some more results in Maine as well. So We'll go back there and then to Kevin. Yep.
Do you just quickly have the number of negative tests that we have so far?
Our epidemiology team, candidly, was focused on a rather intense issue this morning, and so we will similarly get you the number of negatives very, very soon. It's being tabulated as we speak. Yep, Brad?
We've had a lot of new cases here, for the last 3 or 4 days now. Do you know how many of them are from out of state who came back home, maybe from out of state or out of the country?
So the question is, given the increase in cases that we've seen, what number of those are from out of state? And I want to say 2 things there. The first is this uptick in cases is what we anticipated. It is what we planned for because of the experience that we've seen in other parts of the country. So this increase in cases is not a surprise, and I want to be really candid. We expect that it will continue. As in any outbreak, there's a portion of that outbreak where there is a rapid uptick in cases. We've seen that in other countries. This is what we have been planning for, and we are now in the thick of it right now, and we're keeping on top of that. Now, in terms of the number of cases who might be from residents who are out of state, again, we'll try to tabulate that if we can. I'm not sure. Yeah. Oh, I'm sorry. Yeah, we'll get to folks on the phone. We'll try to tabulate that if we can. I can't make any assurances that we will have that. The reason I say that is that the number of cases from residents who happen to be out of state does not change the risk profile for anyone in Maine. Everyone in Maine right now should be practicing going about their lives as if coronavirus were here, irrespective of what you see on the license plates. Coronavirus has been here. It will continue to be here, and we anticipate additional cases. We have folks who are on the phone. My apologies to those folks. Don Kerrigan, please chime in, sir.
Thank you very much. I have a question for Commissioner Landrieu and one for Dr. Shaw. For the Commissioner, regarding the DHHS office, come in, or are they doing all inside work and reaching out to clients over the phone? And for Dr. Shaw, I would ask, I get comments from people, gee, is this as bad as the flu? Because we still have lots of people who get sick from the flu, and even now we're having people die from the flu. So if we could comment on those 2 things.
Sure. And for those who couldn't hear, the question was, have we limited public engagement or entrance into our main DHHS offices? We have 16 offices throughout the state that are used for people to meet with our personnel, to sign up for benefits, to renew benefits, to have the kind of engagement that we have with the public. We previously had limited people's use of those offices just to drop off necessary paperwork. We also are cutting back on the hours that those offices are open to the public. We have cut our traffic down of people coming into those 16 offices significantly, so it really is very few people statewide, and we are contemplating taking additional measures. We have successfully moved many of our people to telework to the point where, while we've had a surge in applications for Medicaid and Maine Care, a surge in applications for food supplement or SNAP, we have been able to keep on top of that surge in applications because the workers who have successfully transferred to home have been able to keep up with those applications. So the short answer is yes, we have limited significantly the office hours of those offices to prevent COVID-19 spread, and we will continue to take measures as appropriate.
Thank you, Commissioner. And Don's second question is, how does COVID-19 compare to the flu? And is it worse than the flu? So Don, I want to answer your question in 2 ways. The first is by talking about what we mean when we talk about diseases. What do we mean by worse? And there are 2 ways to think about how a disease might be worse than another disease. The first is that it might be more easily transmittable from person to person. It could spread faster. The second is, sadly, that it might result in more deaths. On both of those measures, COVID-19 poses a lot of concerns for us. On the first one, how quickly can it spread? I think anyone can take a look at just the experience in Maine, let alone the experience in New York City and other places, to see just how rapidly COVID-19 can spread. The numbers there bear that out. COVID-19 can spread, each person who gets COVID-19, on average, can spread it to anywhere from 2 to 3 people. Each person who gets the flu spreads it on average to 1 to 1.5 people. Now that may not seem like a big difference, but if you play that game out, it makes significant differences in this set of cases we've got. Now the other axis that we look at is how many people may die. And that's grim, but when we talk about infectious diseases, we've got to be clear about this. And even there, COVID-19 is concerning. According to the best available statistics, COVID-19 may be anywhere from 5 to up to 20 times more fatal than the flu. Now, epidemiologists around the world are trying to figure out whether it's the lower number or the higher number. But no matter what that number is, it's significantly more concerning. All of this comes at a time when we are nearing the peak of our flu season. So at baseline, our healthcare system is contending with high numbers of people who have the flu and caring for them and providing services to them. On top of that now, our healthcare system is also providing care for folks with COVID-19. So when you combine those factors, a disease that can spread more easily, that can sadly result in more deaths, on top of a healthcare system that's providing services for ill people with the flu, it results in a high level of concern for us. I'm going to go to Kara DeRose next, who's also on the line. Kara, your line is open. Okay, we'll turn back to the. I'm sorry, Commissioner.
Going
Yes.
back to our stress healthcare system, I do want to reiterate that is why the governor issued the executive orders on trying to ensure that our healthcare providers in the state continue to provide care. We can't have our healthcare providers sitting on the sidelines. We need you through telehealth, through phones, through digital medias to continue to support our healthcare system. Mm-hmm. Second, we have gaps. We need your help. So if you can volunteer to fill in some of the gaps, the medical response group is there to catch you.
Absolutely.
And then third, they need help as well. So to the extent we can support our healthcare providers to deal with this challenge, we appreciate it.
Dustin, right? Joe.
Close though.
Apologies. Joe.
Quick question. Talking about positive cases, I know your priorities around figuring out how many we have and going forward with that, but talking about the recovery cases, have you learned any new information about how fast you recover or anything going along those lines?
Joe's question, and it's just Diet Coke that I'm a little backed up on, that's all, not a cold. Joe's question is around, similar to the cases that have been confirmed, we also report number of cases that have recovered, and what can we learn about that? And again, in keeping with the analysis of confirmed cases, we're also looking at who has recovered, their ages, and what we can learn about the rate of recovery. When did they get sick versus when did they fully recover? That analysis is underway as well. Again, we want to try to compare our recovery rate to the recovery rate in the published literature and make sure we're learning as much as we can. The reason for why that's important for people in Maine is because we want to make sure the advice that we're giving, to stay home, to take care of themselves, to make sure that advice really bears out in the overall recovery rates that we're seeing. Again, our epidemiologists are reviewing those data, and once we've got more to share, we certainly will. We certainly will. So, Kevin?
To follow up on the testing,
Mm-hmm.
do you have any updates? Yesterday you mentioned there were about 1,300 cases that were in the backlog. Do you have any updates on that? And then can you just talk about the timing of that new piece of equipment that you said that the state is actually actively going out and purchasing, right?
Yep. So, again, just joked on a little bit of Diet Coke. Kevin's question is around testing. The first is the backlog, and then the second is the new piece of equipment we're purchasing. The backlog today stands about where it was yesterday, approximately 1,300 tests. I underscore again that that number is unacceptable to us. And for that reason, we've moved forward with trying to put into place an action plan to clear it out. We fully acknowledge that individuals who have had submitted tests by their clinician may have had to wait longer than they would have wanted to. We acknowledge that. We don't find that number to be acceptable in any terms. And despite that number being what it is, we are committed to reducing that as quickly as possible. One of the ways in which we are working to reduce that number is by bringing on an additional piece of equipment. We understand from the manufacturer of this piece of equipment that they too are experiencing a backlog on their end with just shipping out the machine. Based on the latest information we have, we believe that the manufacturer will be able to send the machine to us in the next 1 to 2 weeks. After that process, after we receive the machine, there will be a validation period similar to what we did with the machine that we purchased not too long ago. That validation period will be a few days. After that point, we'll be able to go online with that. Again, this backlog is concerning to us. We don't find it acceptable. We are working to resolve that as quickly as we can. Sadly, the backlog is the result of a nationwide shortage of these vital chemicals that we need. We did receive some chemicals today just a little while ago, and so we hope that that will help us. But we are also making sure that we can get tests out to the highest risk individuals, such as individuals who are in the hospital, individuals who are critically ill, so their healthcare providers have that information and can start making clinical decisions for them. So, Michael, and then we'll go to Brad.
Yeah, I just have a question sort of farther down the line. In New York City, the state and feds, as you know, are turning the Javits Center into a big, a massive hospital complex, essentially. Has the state started identifying facilities that could serve a similar purpose here? And if not, where is that in sort of your hierarchy of many eventualities here?
Good. I'll start Michael's question and turn it over to Commissioner after that. So Michael's question is, how are we looking at alternative care sites in the event that they may be needed here? And certainly, Michael, at the top, I want to say we hope that they're not needed here. We hope that the measures that we've recommended, that the governor has implemented, will help us flatten the curve so that the healthcare system can continue at its current staffing levels to take care of all Maine people with COVID-19 as well as other diseases like the flu. However, and as much as we hope that that's not the case, hope's not a strategy that we can rely on. And so we are also making plans for what are called alternative care sites. And those plans take different forms. One is to try to augment the existing capacity at hospitals on their physical grounds. The second plan is to look at facilities that recently have come into disuse in Maine to see if they can be reactivated in the form of a healthcare setting. The third is, in concert with the Army Corps of Engineers, to look at other facilities across the state that could be rapidly converted into a healthcare setting if needed. We hope it never gets to that. But if so, our planning process is underway. Commissioner Lambrou?
I'll only add that what we're going to be doing is going from this first phase of response where we're trying to ensure our hospitals have the PPE, have the support they need for this phase, to look 2 phases ahead to see where might we be and how do we plan from that. So there's both a ground-up approach, which Dr. Shaw just described, but we're also soon going to be talking to the heads of our hospitals, our regional offices, our regional actors to figure out what from the top down we should be thinking about for 3 or 6 months from now.
Mm-hmm. Brad, yeah.
You talked about treatments yesterday. Do you know how hospitals are treating the 15 patients right now, and are they having success at all?
So the question is around hospital protocols around treatment. And what we know about treatment and its efficacy for individuals who have been affected. Right now, we, of course, are in very close contact with the physicians at those respective institutions. Our medical epidemiologists have conference calls with them to keep tabs on the status of those patients. If those physicians have questions that we can answer, we do so. If they have questions that we are not immediately able to answer, we consult with the team at the US CDC to make sure we know the latest information. And so because of that robust communication that's in place, our physicians and our medical epidemiologists are able to provide the latest up-to-date information so that Maine doctors are treating Maine patients with the latest information. Now, in terms of the efficacy of those treatments, as we've noted, the number of cases that have recovered in the United States as well as in Maine is increasing, and that's a positive sign. What we also know about the international data around coronavirus is that approximately 80% of the individuals who have coronavirus have symptoms that what we call self-resolve. They don't need to go to a doctor. They may have what amounts to a very bad cold for a number of days, but no intense medical intervention is necessary. But however, for 10 to 20% of those patients, hospitalization is required. For a smaller fraction, critical care hospitalization is required. Those patients and how they fare, those data are still being worked out at a national level. What I can say is just based on some recent data from the US CDC, even patients who have to be hospitalized do fare well, and that's a positive sign. But what I will also say, based on some recent data, is that the number of people who are hospitalized who happen to be in a younger age category can be quite high. About 40% of hospitalized patients are in a younger age bracket, from the ages of 20 to about 50. That does not mean that 20 to 50-year-olds, 40% of them will be hospitalized. Again, I want to be clear, among hospitalized patients, it is not necessarily older Maine people or older Americans who are in that bracket. So young people themselves have to take precautions against COVID-19. Yep.
People have been asking if they have, fever aside, if they have one of the other symptoms, one or maybe two of the other symptoms between, digestive, cough, how they should go about it, and if they should get tested, and kind of what they should do if they should, change their daily life.
Good. So the question is, leaving aside the symptom of fever, if you don't have a fever, but you do have some of the other symptoms associated with COVID-19, cough, shortness of breath, maybe even some GI symptoms, what should you do? And again, I can't give any specific medical advice to anybody, but based on what we know from the data so far, approximately, well over, in fact, 80% of people who have confirmed COVID-19 have a fever. And so if you don't have a fever, that's a good sign, but it doesn't entirely rule you out for COVID-19. So in that situation, the US CDC's guidance is that whether you have a fever or not, if you're not feeling well for a number of days, especially if you're getting worse, even if you might not have a fever, but your cough is getting worse, your shortness of breath is getting worse, that's a time to call a healthcare provider. That is really the time when you want to reach out to your healthcare provider to make sure that you're getting expert advice. These situations are highly fact-specific. And so I can't give out any specific advice, but what we know from the data is that a lot of folks do have a fever, but not everybody. And so if you're not feeling well, and you're not getting better, make sure you reach out to your doctor. Other questions? All right, well, thank you very much, everyone. We very much appreciate this. I just want to end by again noting that these are difficult times. In some instances, it's sometimes like watching a movie. And people react, everyone reacts to times of stress in different ways. And so I again ask everyone, although we need your support, we need you to volunteer, we need you to donate blood, we also need you to be kind and take care of one another. So thank you very much. We'll talk to everyone tomorrow.
Same time, same place tomorrow.
Okay, thanks. Hey, Rob.